I will be definitely much faster in terms of the timing. I'm going to finish in 10 minutes, hopefully. So the reason I wanted to do is I presented the genetic studies 2 years ago, right? And I presented several places, and I got many emails from parents, my child is eligible or not, right? So I wanted to give an update on that. First, the genetic studies, and two, like what is the role of these genetic studies? Before starting my talk, I wanted to say two things. One, I know that there's M2DS, another company. We just did the webinar this past weekend. I think it went online, I think, like very soon. Or it's out now, I guess. So you're going to hear that talk from that company as well as I was there. I wanted to state my position in that, like, I am, as a physician scientist, supporting anything that wants to bring treatment. I think same for your families, you want anything, any treatment for your child, everyone wants it, right? So that's my role. When I try to support siRNA work, it doesn't mean that I'm kind of undermining ASO work. I think they're very important. I just want more options for our kids. Okay, I wanted to state it. And anyone who wants to develop treatment for MECP2 duplication, they get my support for sure, okay? I wanted to say it because we are lucky for MECP2 duplication. It's a rare disease, but we still have 2, and maybe as Katie showed, there are maybe 3 more to come. We are a lucky community because there are many diseases much more common than MECP2 duplication, but they still don't have options, treatment options or whatever. But we are lucky in the MECP2 duplication world. That is one. Number 2, I wanted to emphasize this. The genetic studies, I work a lot with Ionis. That's why people are mixing things up. For example, the genetic studies I am going to present now is pure research purpose. So when Ionis is classifying, I will start with this. We published this genotype-phenotype paper. I think this is the most comprehensive 137 individuals that we did very detailed genomic studies. Okay, it was very comprehensive. And as you can see here, I don't know. Okay, here, Ionis announced that the ION-4 for the trial, right? And you can see it here. It's not very visible from here, at least. So certain genetic subgroups are not currently being run in the clinical trial. If you have a terminal duplication, translocation, or triplication, they say you are not eligible for this ION-4 for the trial. There are 2 things. One, our lab is a genetic research lab. When it is a research lab, Ionis cannot rely on our data. That's why they need to run their own genetic study in a certified clinical lab. That's why they run their confirmation whether your child is in this group or not. Okay? So ours is, I can tell you what is the result of your child, but I just wanted to say that definitely they need to run their own genetic study so that it's going to be whether eligible or not. So they can't rely on a research lab. That's one thing. So yeah, I wanted to be very quick. I'm not going to go over too much about it. As I said, there are different subgroups. They are excluded, right? If you remember, 2020, whatever, we were saying that there are 3 groups, and I know that families were asking what type of duplication your child has. They were saying, oh, I have complex, no one had triplication alive that I know of, or simple duplication. So these 3 groups now split into 5 different groups with that paper, okay? And the clinical trial is only eligible in these 2 groups now. Don't mistake it. Don't take that, oh, these will never have a trial. No, there will be potential trial in the future for these groups as well. Maybe a higher dose, we don't know, but this is going to evolve. But for now, they are just doing it in the first 2 groups. So that's why that paper is important. I wanted to give. Were you going to say something, Paul?
Copy number has to equal to.
You mean duplicated?
So for other complex, it's not all
Yeah.
complex, but so that it has to be copy number 2, non-terminal.
Yeah.
No mosaics.
For example, terminal duplication.
I'm talking G2.
Yeah, I see. Yeah, this is an older termination. You see, this group is now another one. This is another group. So That's the main reason I wanted to do this other complex. This is an evolving process. So what I mean with that, let me go over it quickly. So these are the, like MECP2 duplication is here. As you can see, this is the actual chromosome, patient karyotype chromosomes. MECP2 is right at the end. This is the same thing. This circle is this one. This is much higher resolution computer drawn. So this is all the way here. So when this duplication, the extra copy is too much all the way to the end, that's called terminal duplication. And some of those who has duplication all the way to the end, okay, all the way to the end, some of them are translocated to another chromosome. For example, from they have a duplication all the way here, but another piece here as well. That's called translocation. I wanted to say this. Okay. These are the pictures that we mentioned. Some of them is triplication, not too much. I know that 2 years ago when I came, there was a triplication child here. And I know that the patient passed away around 3.5 years. So after 10 years or so, we found another triplication that was him, but unfortunately we lost him and we couldn't get blood from him. So we tried to work on it, but it didn't work. So in our paper, we found that about half of them has tandem or simple duplication, and a quarter has terminal duplication or translocation. So kind of 25% of the current patient population is not eligible for this time, at this time. Why this is important? From group 1 to group 5, many features worsens. That is the reason we are not including these more severe kids because, I mean, for one, there's patient safety issue. 2, we don't know how much the other genes are playing role. That is the reason I wanted to, and severity worsens from those groups as well, from group 1 to group 5. So in that, when we published it last year, okay, that paper, genotype phenotype paper was published last year. Actually, again, Paul, he came to me, he said that he presented natural history study. He said that he has 2 terminal duplication patients, okay? They are walking as well on top of, because in the original paper, we had 28 patients and only 1 terminal duplication and 1 translocation kid was ambulatory. The others were not walking. I was saying that to the families, if your child is walking, very, very highly likely chance that he is on group 1 or 2. But after Paul told me, I went and looked at our data. Now we have 180 patients or so. And we have 2 in the translocation and 3 in the terminal duplication are walking. So that means is, overall, the bottom line of this talk is, these genetic studies are an evolving process, okay? What I knew 2 years ago is different now, maybe, okay? And actually, it's in the positive way, it's impacted me. As I said, none of those, or like very few of the terminal duplications can walk, but now I said about 15 to 20% are walking. So to answer them, for example, help future clinical trials, not to exclude terminal duplication translocation, we need to continue genetic studies, okay? That is the bottom line. So genetic studies, our genetic studies are not linked to Ionis or any other company. This is, the second thing is, it's an evolving process. We have more patients, that means we have more accurate data, okay? It is a big progress. I can say that it's one of the studies that we are they are doing the trial, Ionis is doing the trial based on genetic information. That's why it's important, but we still learn a lot. Every child gives another information. For example, I don't know if you know, MECP2 is always duplicated with another chromosome called IRAK1. We haven't had a child who doesn't have an IRAK1 duplication. They always go together. So if I find a patient that's going to answer a lot of questions, what is the role of IRAK1? We don't know the role of IRAK1. So that's it. Happy to answer any questions related to genetic studies.
Thank you very much. Thank you very much, Dr. Pehlivan. Is there any questions this time? No? Thank you very much.
Yeah.
Thank you. And thank you, Katie.